Good morning and welcome to Healthy Super Mornings with Dr. Shilpi. Uh, this month, especially the month of September, as we have discussed, the first week of September is the world. The whole month of September is PCOD Awareness Month, and the month of September is also Ovarian Cancer Awareness Month. And yes, today's topic would be definitely on something related to it. And if you have to believe, all three are definitely interlinked. And when we have to talk about knowing how they are interlinked, I will tell you the right amount of nutrition, the right quantity and quality of nutrition will prevent obesity. And anything that prevents obesity, anything that gives good nutrition is another factor of controlling PCOD and also a factor of controlling obesity, which is one of the reasons of ovarian cancer. PCOD is also another reason for ovarian cancer. So they are all interlinked and they are all intertwined, and every disease, be it acute, be it chronic, be it long-standing, be it non-cancerous or cancerous, it is all linked to what we eat. And when you talk about things, what we eat, our nutrition, our intake of any food item is definitely linked to how well we are that day, that time, and also in the future. That is why it's all about superfoods, and all superfoods definitely have cancer protection, definitely have anti-aging, definitely have all ingredients and items and benefits that prevent metabolic syndrome, obesity, and anything related to diabetes, hypertension, inflammatory disorders, and all that. So today we're going to talk about ovarian cancer. It's not only about women, it is also about men who have their loved ones, their mother, their sister, their wife, their aunt, their grandmother, and without women there is no future. And when we have to talk about women, it is all about women's health to know about ovarian cancer. September is Ovarian Cancer Awareness Month, and we're going to talk about ovarian cancer today. What is ovarian cancer? When we have to talk about ovaries are the organs. They are part of the reproductive organs, which are two in number, and they are one on each side of the uterus, and they are responsible for egg formation, and one egg forms from each ovary alternate month, and that egg formation gives rise to pregnancies. And on a regular basis, if egg forms, the fertility rate is good, the periods are good, and that is how the start of womanhood and until menopause the cycle lasts. And when we have to talk about ovaries, ovarian cancer is one of the 6 leading causes of cancer in women. It's the 6th leading cause, 5th to 6th leading cause of cancer in women. But the problem with ovarian cancer is it is diagnosed late, and anything that is diagnosed late, the treatment aspect are in the relapse is more, the death rate is more. That is why we need to have an awareness for ovarian cancer. Now, if we have to talk about ovarian cancer, there are several risk factors for ovarian cancer. Being obese is one risk factor. Being, not having children is another risk factor. And you have extended periods of menstrual cycle, that very early menstrual cycles, and if it lasts till late, then that is also a reason for ovarian cancer, infertility issues, obesity, PCOD. There are so many factors linked to ovarian cancer, and one of such factor is the genetic factor. People with family history of ovarian cancer or breast cancer or colon cancer in their family, especially their mother or grandparents, or aunt, maternal aunt, or say sister, or anybody related to them. If they have ovarian cancer, then the chances of having ovarian cancer is little high. And there is a gene called BRCA, BRCA1 and BRCA2. These genes, the presence of these genes can be tested, and these genes can give a little higher risk of having ovarian cancer. There are another two genes which are associated with Lynch syndrome. These genes are BRIP1 and RAD51C and RAD51D. So these are also a little high risk. When these genes are present, there is a little high risk of ovarian cancer. And there are several factors which we can avoid. How we can avoid several of these factors is keeping your weight under control, having antioxidant food, having your lifestyle under control. You can use birth control pills which have protection against ovarian cancer, and also they should be taken under supervision of a doctor. And the several years of menstrual cycles are definitely not good. That is why childbearing and child rearing is another aspect of prevention of cancers also. And that is why people who had multiple children had lesser incidence of ovarian cancer and other cancers like breast cancer, which has a protection rate if you breastfeed the baby. So that is also very important. And somebody who's not planning pregnancy, definitely you can opt for birth control pills which have a beneficial effect against certain cancers like ovarian cancer. And especially in terms of obesity, childhood obesity, overweight in adolescent girls, and a lot of fertilizers and pesticide residue foods, and foods that are given hormones, especially the estrogen hormone and the oxytocin hormone, and all these hormone, what do you call them as hormone, whenever you take vegetables which are having hormones, whenever you have milk products which are hormones, and whenever you have high fatty foods that can give you a lot of fat in your body and obesity in your body, your chances of having a early menarche, that is periods coming for girls at the age of 8 and 10 and 12, very early, anything before 12. So there are women, there are children who are getting periods at the age of 7, 8, 9, 10, which is very early menarche. That is also has to be avoided. The intake of food has to be regulated. The intake of junk food especially has to be regulated in young girls, and that is how they will have a healthy reproductive tract development, a timely periods cycles like menarche, and also encourage them to have weight management in their life for health. And all superfoods give protection against obesity. All superfoods give protection against all types of cancers. And when till you're planning pregnancy, you can be on birth control pills. Once you are into relationships and you don't want to have unwanted pregnancies, you can have birth control pills under supervision of doctor. And also contemplate early, if you have things about conception and delivery and rearing children and all that, plan them early, plan them accordingly, and use and also breastfeed the baby, so that you will have a lot of protection. Other than the advantages what the children have, the mothers also have lots of advantages. So this is how ovarian cancer, the risk factors of ovarian cancer, how to prevent ovarian cancer, and also an aspect of early diagnosis. Now, if we talk about symptoms of ovarian cancer, they are just general symptoms like bloating, pain, heaviness in the abdomen, and irregular bleeding, spotting at times, and you feel tired very soon. That is called fatigue. And you might feel less energized. There are gastrointestinal symptoms like loose motions or constipation or bowel irregularities, and especially heaviness in the abdomen, and also chronic fatigue, weight loss. All these things are few of the symptoms that we can anticipate to know what is the reason behind these symptoms. And symptoms like these are generalized. Even people with bowel upset have these symptoms, but not for so long. Even with the tuberculosis, people have weight loss and all that. But yes, we can figure out. And that is why comes the role of an annual screening. Whenever women are encouraged to have annual screening, especially the men in the house should encourage women to go for annual screening, because their life depends on a mutual partner, a mother, a sister, a grandmother. So whenever you have to express your love towards them, definitely you have to express your love towards them in the form of caring them, not only giving them expensive things, not only giving them luxury, not only giving them needs that they want. You also should have to encourage them to have their regular annual checkups, their vitamin intake, their food regulation, their health checkups are really, really important. And when we have to talk about health checkups, annual pap smear examination for cervical cancer, an ultrasound examination yearly once to know the uterus, the ovaries, and all these things. And along with self breast examination for all women who have crossed 40 years, definitely a mammography should be there in your annual checkup. So these are the few things that we use for the aspect of screening, and the aspect of early diagnosis, and also the aspect of prevention. And every time that I talk, it is about prevention. Why I have ventured into the concept of food and concept of health being an obstetrician is, unless and until you clear the ground reality of one's body and bodily functions and what they intake in terms of food, you would never be able to clear the aspect of problems in health, chronic problems, and diseases like cancer, diseases that are related to nutrition, diseases like all these aspects of ill health. And every aspect of ill health has a concept of food attached to it. So that is why I have ventured into food and about health and food and its relationship. So about ovarian cancers, screening is important for everybody, and especially when people have family history, you have to check. All possibilities are there. You have to check for your BRCA gene, you have to check for the if there is a family incidence of Lynch syndrome, you have to check for the RAD gene, if you have to check for the BRIP gene. Most commonly we advise the BRCA gene, BRCA1 and BRCA2. Even if the gene is positive, there's nothing to worry. It is all that you have to yearly have a screening and examination to figure out if there is any problem. Most likely the chances would be there would be no problem, but that feeling of having a diagnosis without without any doubt that your reproductive organs are normal, that itself is a very good feeling, and that is very important for everybody right now. So it is important that you have an annual screening. It is important to check your risk factors if you have family risk. It is important to curtail obesity in the current time, because obesity is running as an unknown underground pandemic in everybody's life. So obesity should be avoided. Health as priority, annual checkups. If you can take birth control pills if you're not planning pregnancies that have a protection rate against ovarian cancer. It is important that you fight against obesity, and it is very important that the child caring system should be in place. Anything that has hormones in it, any contaminant, any pesticide residues, anything that is falling in line with the normal development of the children should be looked into, and they should be there should be regulations and regularities, and the source of food should be checked. That is why I always advise natural farming methods, organic foods, and also free from fertilizers and pesticides and additives and enhancers, and that which is there in packaged foods, wherein anything from the packet is definitely not good for you, not good for the environment, not good for the carbon footprint, not good, not sustainable at all. So look into sustainable living. options, and whenever you look into the sustainable living options, you will fall into place, and anything that is healthy will be yours. Your health will be protected, and you will definitely have your cancer protection rate also. So this is all about ovarian cancer and its prevention, and we spoke about how to diagnose it, how to prevent it, even about diagnosis. Annual screening examinations can be very informative, and also if you have any symptoms, definitely you have to check with the doctor as soon as possible. Get an ultrasound. Though test, the cervical pap test gives screening for cervical cancer, it does not give screening for ovarian cancer. An ultrasound examination, a cyst or a mass or anything that is there next to the uterus, or if you have a doubt, you have CT scans, you have MRIs, you have so many other methods of knowing what it is. So early diagnosis, early treatment is very beneficial for ovarian cancers, because they are diagnosed very late with huge masses, and there's so much of unknown things that happen behind every woman. So they are diagnosed late. That's why their criticality is more, the death rate is also more. But if you diagnose them early, definitely you can have a lot of benefit in terms of treatment. And it is not only about ovarian cancer, it is about the health of women in your life. So it's the men's men's interest to get into knowing about these things, treating special your loved ones, taking them for a general examination every year, and taking care of them, because any woman would definitely love the man, whatever the way the man is, but would love more, and the bond would definitely more if you care for her. So that is about ovarian cancer, and this is Ovarian Cancer Prevention Month, and September is having lots of medical significances, and we will definitely look forward to prevent, and with healthy food, healthy lifestyle, and health as the source of our living. So this is all about today. Hi Mansi, hi Varsha, hi Prashant, hi Bhavya, hi Harini, hi Saumya, hi Indu, hi Vandana, hi Suresh, hi Fani, hi Pooja, hi Murti Garu, hi everybody, hi Subbarao Garu, hi Augie, hi Bhaskar Reddy, hi everybody. So this is about ovarian cancer and its prevention, and yet another super topic tomorrow morning. See you live 7:30 with Dr. Shilpi and Super Mornings.